Hi everyone, we are from Group 6 and today we are going to present about tubal ligation. Tubal ligation is a permanent contraceptive method with more than 99% of effectiveness. According to 2015 World Health Organization report, this method was used by 19% of women worldwide. However, its prevalence varies extensively around the world with a prevalence of 22% in the United States and lower than 10% in Europe. Tubal refers to fallopian tube that allows egg release from ovary to travel to uterus, whereas ligation refers to tie-off. Tubal ligation is hence defined as a female sterilization procedure that prevents egg and male sperm from connecting and thus prevent pregnancy. Tubal ligation is indicated for women who want a permanent method of contraception and are free of any gynecologic pathology, and also it is used for women in whom a pregnancy could represent a significant clinical and medical risk. There are two types of sterilization procedure, namely tubal ligation for female sterilization and vasectomy for male sterilization.
Next, there are benefits and risks when one decided to undergo tubal ligation. First of all, tubal ligation is a procedure that is permanent, which makes one does not need to worry about forgetting to take pills, counting days on calendar, use condom or come back to see doctor to reinsert or reimplant their contraceptive intervention. Tubal ligation are also reported to demonstrate protection against development of ovarian cancer. Besides that, reduced risk of pelvic inflammatory disease is also observed following tubal ligation. Apart from that, there is no significant change in menstrual cycle occur following tubal sterilization, unlike other contraceptive intervention. Tubal ligation is one of the contraceptive interventions that have low failure rate, with only 1 in 200 women get pregnant after tubal ligation procedure. However, there are several risks that need to be considered before deciding to do tubal ligation. Patient regret following the procedure is the most common long-term complication of sterilization. If women that have undergone tubal ligation pregnant, it is most likely that it is ectopic pregnancy. Next, although serious surgical complications are rare, due to invasive nature of tubal ligation, surgical risks such as bleeding and infection are reported. Some studies report that tubal ligation increases women's subsequent risk of needing a hysterectomy, a procedure of uterus removal. Lastly, because tubal ligation is permanent, only around half of the women are able to get pregnant after reversal, so it is not advisable for anyone who are uncertain of their decision to do it. Only do it if you are really sure that you do not want child or do not wish to have children anymore.
Next is the procedure for tubal ligations. Tubal ligations involve invasive surgical procedure by sever the fallopian tube by cauterization, tie and cut, and bend it. There is 3 different types of the procedure. First is laparoscopic tubal ligations, second is mini laparotomy tubal ligations, and third is laparotomy tubal ligations. Before operation, patient will be started on IV line and given general anesthesia. Next, we will watch the animation video for tubal ligations. The surgeon will make a small incision about half an inch long in or below the belly button. Then, a harmless carbon dioxide gas is injected into the abdomen. This raises the abdominal wall of the pelvic organ so that the surgeon can get unobstructed view and also room to operate. Next, a laparoscope is inserted through the incision to view the tube. Next, a small device will be inserted to move, hold, and close off the fallopian tube by cutting, placing tubal rings, or cauterizations. Then, after the procedure ends, the laparoscope is removed and the incision is closed off. Next is mini laparotomy tubal ligations. A small incision will be made just above the pubic bone. Then, The fallopian tube will be grasped by using forceps and close them off by using either placing tubal rings, cutting, or cauterizations. Then the incision is closed. Third is laparotomy tubal ligations. 2 to 5 inch of incision at lower abdomen to be made. And then the fallopian tube is located and being closed by using cutting, placing tubal rings or cauterization. Then the incision is closed off.
Moving on to the side effect of post-ligation procedure. After surgery, patient will be observed for a short time to be sure that there are no complications. Most women can go home within 2 to 4 hours after the procedure. They may feel some discomfort or experience other symptoms that last a few days, such as dizziness, nausea and vomiting, shoulder pain, abdominal cramps, bloated feeling, or sore throat. Sore throat may occur if the anesthesia was administered through the breathing tube. Most women return to their normal routine within 1 week of surgery. Post-tubal ligation syndrome often occur as a result of rapid decline of estrogen or progesterone as the blood supply being damaged to the ovaries during the tubal ligation procedure. Depending on the damage to the veins and capillaries, blood volume to the ovaries may slightly decrease or eliminated, which is also called as isolated ovarian syndrome, which is commonly occur in hysterectomy operation. Other theories of post-tubal ligation syndrome: target or receptor cells that are important in the relay of hormonal messages are damaged, destroyed, or removed during the tubal ligation surgery. It is possible for a woman to have both her ovaries still functioning to some degree, no major problems with her uterus, but still experiencing post-tubal ligation syndrome in the form of hormonal imbalance that is caused by change in her hormonal message relay system due to receptor cells being removed. Some of the symptoms of post-tubal ligation syndromes are associated with hot flushes, insomnia, reduced sexual activity. Other symptoms such as heavy, painful periods may be caused by hormonal imbalance that is due to adenomyosis, which is damage of uterus muscle and tissue. Irritability and mood disorder may also occur due to post-tubal ligation syndrome. In conclusion, tubal ligation is indicated for permanent sterilization. Hence, patients need to be informed about all the benefits and risks of the procedure. We hope that you get the benefit from our video. Thank you.